I'm just a male nurse. I am actually a psychiatric or mental health nurse. I have been doing this for quite some time. I have done it in maximum security psychiatric hospitals where you have patients like Hannibal Lecter, and I've done it in the community as well. I currently work for the FACT team, which you probably heard before. Is the Florida Assessment Community Treatment. What we do is we get patients that are, the majority of them come from state hospitals. They have spent time in state psychiatric hospitals. What I mean by time could be 7, 10, 15 years, depending on how seriously ill they are or what they did when they were out in the community. And they come out with a court order, and that court mandates them to be under the care of the FACT team. My job basically is to make sure they're taking the medications, that they're stable, that they're not going into a crisis, and if they are going into a crisis, I'm supposed to detect that right away. Once I see they're going into a crisis, I do something that's called an ex parte with a licensed mental health professional, and we go to court and we tell the judge why they need to be Baker Act, and this is against their will, and police usually shows up within 2 hours and takes them to a crisis unit that we have.
Can you explain Baker Act quickly to the class?
Baker Act is when you go into a psychiatric examination for a minimum of 7 days without your permission, against your will. If I find that a patient is suicidal, or I see the patient is decompensating because they haven't taken their medications in a couple of weeks, and I feel they're going to be a threat to the community, I do an ex parte, or we do a Baker Act, and we take them into a crisis unit that we have. We have 3 crisis units that work in the Orlando area. We have one in Volusia County, one in Flagler, and one in the San John area. And patients can be there from 3 days to several months at a time. If we don't get them stable enough to return to the community back to me, we get sent them to a state hospital near Tallahassee. Is where they go. I love my job. I like to pride myself in saying that I haven't had any readmissions since June of last year. That could change any minute. It all depends on how the patients do. Sometimes they do things like committing suicide, and that's something that sometimes is out of your control. Most of the time you don't get any signs when that's going to happen, and it's sad, but it's the nature of the business. And we just do it every day. How it relates to constitutional law, believe it or not, psychiatric patients have the same rights as you do, same rights as a patient. You have to explain to them what medications they're taking, why they're taking them, and how it's going to benefit them. They can refuse a medication, and we can try to change it, but if it's court mandated, they'll have to take it. If they don't take the medication in the community, again, I get the police involved, they go back to the crisis unit, we get them stable on a different medication in there, or until they realize they need it, and then they'll release again back to us. It could be anybody out there. The numbers are somewhere within 1 every 6 person has a mental health illness. So you could go to Publix and your cashier could be schizophrenic and you don't know they are. So as they're taking this medications that we give them, they're getting their therapies, they are pretty much okay to function 100% in the community. And they're right as a human being.
Is this the career that you wanted to get into?
No. I prefer trauma ER, little bit more blood, more action. I got into this career in Canada. I was living in Canada, and there wasn't a lot of work in general hospitals. And the psychiatric hospital at the time, one of the truth was it paid better than the general hospital. So I went into psych, I liked it, and I stayed in psych. And that's what I do.
Okay, yeah. All right, go ahead. No, you can go ahead. Yeah.
Okay, so You know, sometimes when people get arrested and they be having like certain issues, do you guys also deal with those inmates as well?
What kind of issues?
Psychiatric issues, like just,
If once the patients go to the county jail, if they have psychiatric issues, they get transferred to the hospital for assessment. They also have their own psychiatrists in the jails that do assessments
so
on
you
them.
guys don't deal with inmates at all?
We don't deal with inmates. As long as they're in either the state hospital or a jail, we don't deal with them. Now, if they are all patients that we do an ex parte or a Baker Act, when they're in the jail, we deal with them. We provide the injections. We do psychotropics that are injectables that are once a month or every 2 months. We go in the county jail, we do those injections to make sure they keep up with their medications, because that's what's keeping them stable.
Right.
For example, we had one of my coworkers had a client last week that got trespassed from a house that she was in, and she was telling the police that was her house, but that house belonged to the actual Daytona Beach Police Department. So she got arrested. They knew it wasn't her house, they knew it was their property. So she went into the county jail, I went into the county jail and I gave her an injection that she was due for.
Okay.
That's how we deal with them. Anything else has to do with court or anything like that, we don't. The only court process that we get involved is the Stewart-Marshman Act, because I work for the Stewart-Marshman Act. So basically the Marshman Act is for people who are drug addicts, and the family can go to court, request an Stewart-Marshman Act. If it gets approved by the court, they have to attend rehabilitation, or they can be put in jail for whatever time the judge gives them. That's how we go to court with them, to represent them in the Stewart-Marshman trial, and we get to extend the time if we feel that they need more time before they get released from the court order. Other than that, we have nothing to do with the court.
So is the job what you expected it to be, or what you imagined that it would be when you decided to take it for more money? Is it what you expected it to be?
Nursing is not just a job, it's an adventure. It's not. I mean, every day in the morning, when we walk into our office, I'm the only field nurse in the whole group, that in the whole FAC team in Volusia County. We do a huddle in the morning with all the mental health therapists. We discuss our patients for the day, and we go out. Once we do that meeting, we find out what's going on from the previous day with everybody. It could change. It could change from as much as somebody didn't take their medications the night before to someone is missing since the day before and we haven't been able to find them. We had a patient that was missing for 4 months. When we found her, she was pregnant. She's more stable now that she's pregnant, and she was without medications for 4 months than before when she was taking the medicine every day. But we found her, she's back on her medications, we're helping her with the pregnancy. So it's an adventure. It's not what I expected to be. I expected to be in a trauma room, saving lives in a different way. I'm not, but I like what I do.
What's gonna happen with the baby? Sorry.
She's gonna give the baby up for adoption. She's working with a company up in Volusia County to set up an adoption, what they call a direct adoption, and give the baby up. She has another kid already that's about 4 years old that lives with her parents.
Are your tenants living within the facility, or are they free to leave and come back?
They live next door to you, next door to your brothers, next door to your friends.
Okay, so
They all most of them have disability because of the mental health illness. And what we do is we have them living in the community like any regular person. The ones that don't have disability yet or can't afford it because they don't get enough money, or foundation, the Stewart-Marshman Act pays for their rent, their electric bill. We give them money for the bus. We help them with doctor's appointments. I handle patients that have severe psychiatric conditions with symptoms, as well as chronic conditions, because I'm the only nurse in the field. So I have a maximum of 12 patients, but they're all very sick because of the mental health illness, and they also have cardiac problems, respiratory problems, liver problems. So I manage both conditions, trying to keep them stable so they're not going to the hospital every day or getting sick and not getting the treatment they need.
Thank you.